Hi everyone, I'm Dr. Rahul Gupta, Senior Interventional Cardiologist at Apollo, practicing in Mumbai and Navi, Mumbai, and Director of Cardium Advanced Heart Care Clinic. Today I'm going to tell you about the angiography procedure because all of us are anxious when somebody is advised angiography, what it is, whether it's a big procedure or small procedure. So just remove all your anxieties. It's a very simple procedure and it can be done very safely. So it is done through two routes. Either it is done through the wrist artery or it is done through the artery on the upper part of the thigh, which is called as the femoral artery. Angiography is a procedure to know whether there are blockages in the heart. It is the sure shot test, the final test for knowing the blockages. Now, when the procedure has to be planned, a person is given certain tests like CBC, what is the hemoglobin, WBC counts. We study the creatinine value because if the creatinine has to be normal, or if it is abnormal, a person has to be prepared so that the creatinine doesn't jump up further. Now, once these tests are done, they are normal, patient is admitted, and he or she is kept nil by mouth, that means empty stomach, for about 2 to 4 hours. Then the patient is taken into the cath lab, and only a small portion of the wrist or of the thigh is made numb by injecting a local anesthesia. It is just like a prick when we take the blood for the investigation. That small prick of the injection is the only prick pain which you get. Then a sheath is inserted, which is about 5 French usually, and through the sheath we take a catheter which is 1.6 millimeter in diameter. We take it near to the heart and then we inject a dye. Dye is a colored fluid, and then we visualize with a camera which is kept on the top of the chest. The camera moves in different direction and we can visualize the heart arteries in various angles. There are one artery on the right side of the heart. This is the right side of the heart, and then there are two arteries on the left side of the heart which originate from a single left main artery. And this procedure usually gets completed within 5 minutes. Once the procedure is done, we know all the diagnosis. We take the patient out if there is nothing needs to be done. This wrist artery is removed, the sheath is removed immediately, a bandage is made, or through the groin also the sheath is removed and the bandage is made. After the angiography from the wrist, we can discharge almost immediately within 1 or 2 hours, and from the leg it will take about 5 to 6 hours to get discharged. Usually there is no pain, or there can be mild pain in few people who are very sensitive. Most of the time wrist artery is used. Rarely when the artery is very tortuous or it is not palpable, then we use the leg artery to do the angiography. So this is all about the angiography. It can be done very safely, and we can get the immediate results. Thank you very much.